Welcome to the GWalk educational course. In this session, we will teach how to properly set up and utilize the device and demonstrate the benefits it has to offer your facility. The GWalk is a small device worn by the patient which records detailed information in regard to their gait symmetry. This information is then transmitted to a computer which organizes the data into explanatory graphs to help better understand and improve a patient's walking abilities. The GWalk is a wireless system consisting of a triaxial accelerometer, a magnetic sensor, and a triaxial gyroscope that, when positioned on L5, allows a functional gait analysis. These mechanical devices allow every motion made by the patient to be captured, no matter how unnoticeable or insignificant. It's very easy to use. Once the device is donned correctly, the patient simply walks a minimum of 20 steps. The GWalk records the detailed gait movements of the patient and relays them to the computer. After the data has been captured, the system extrapolates all of the spatial, temporal gait parameters required to automatically perform a diagnosis or to define a training strategy. With the G-Studio software, a detailed analysis of the patient's symmetry is produced instantly after the data is recorded. G-Studio is a complete and easy-to-use software for the analysis of spatial, temporal, gait parameters, and pelvic kinematic parameters. It includes normative data for all the required parameters. G-Studio allows you to store patient data in an organized and accessible fashion. Once a patient's data is stored, it can be revisited to perform more gait studies, as well as record notes pertaining to each case. The GWalk is small, compact, and portable. With dimensions smaller than a cell phone, the device is easy to transport. Similar gait analysis devices are often bulky and cumbersome. Instead of carrying around large mats, cameras, or lasers, the GWalk can fit in your pocket and provide an analysis which exceeds the other methods of gait evaluations. The device transmits the data with Bluetooth technology. With no stray wires or hard connections necessary, the device is bound by no constraints. Nothing gets in the way or limits the motion of the patient. Just strap it on, send the patient walking, and the results appear instantaneously in G-Studio. Imagine a state-of-the-art gait facility without the expense. Rather than investing a large sum of money to build one, you can get the same or better results with a relatively inexpensive device. You no longer have to designate space in your facility for gait studies. With the GWalk, you can visit your patients anywhere and analyze their gait without dedicating significant amounts of time, space, and finances. In the prosthetic and orthotic rehab environment, obviously there are multiple applications for the GWalk, since the tool is designed to measure gait symmetry. Symmetry is the only way to determine efficiency or treatment from pediatric to geriatric patients. Objective analysis allows the practitioner to accurately isolate asymmetry, which helps them to make conclusions regarding issues such as comfort, musculoskeletal weakness, interface accuracy, component selection, alignment, and gait improvement. Subjective analysis is no longer an acceptable method for justification of treatment. Objective analysis is now the standard for justification of reimbursement for prosthetic, orthotic, and rehab services. Objective, accurate gait analysis can now be printed, emailed, or faxed to physicians, third-party payers, and any who are interested in accurate gait analysis records. Gait studies, pre- and post-orthotic intervention. Gait improvements and further orthotic intervention during the rehabilitation process. Gait study on initial delivery of prosthesis and further gait studies during follow-up visits to justify activity levels. The applications are obvious because the physical rehabilitation profession is focused on patients' recovery. The GWalk can easily and quickly provide objective documentation whether the condition is a result of injury, degenerative diseases, neurological deficit, amputation, and congenital or acquired anomalies. Gait analysis with the G-Walk is reimbursable and necessary during the rehab process. The device can also be used to determine when a patient has reached his or her plateau.